Hi everyone, we are going to get started in just a moment while we let some folks get in and I pin this comment. Hi B Hughes, thanks so much for coming in. We are going to get started in a moment. Just pinning the comment and then we will get started. Welcome everybody. We are about to get started. We're going to be talking about just general COVID conversations today and our experiences getting vaccinated, what we are hearing in terms of misinformation, and all the good stuff. I'm just going to invite my co-host to come on and then we'll get started.
Hello.
Hi, Rama. How are you?
I'm good. How are you?
Good. I tried to get a little plant action in here, but it just looked like it was taking over my face. Doing it for the gram.
Doing it for the gram. Can you hear me? Can you see me?
Yes. How about me? Can you hear me and see me okay?
I can hear you. I can see you just fine.
Cool. Welcome everybody. We're going to talk about some COVID-19 vaccine information, COVID-19 information in general. Specifically today we're talking about whether or not outside will be closing soon, which makes me pretty sad. But before we get into it, my name is Jewel. I work in the External Affairs Department at Whitman-Walker Health as Director of Communications, and my pronouns are she, her, hers.
Hi, everyone. My name is Rama. I work in the Community Health Department, and my pronouns are she, her, hers. And, girl, is outside closing?
Questions that need answers.
Questions that need answers. What is that? QTNA. Okay.
DNA. We love an acronym at Whitman-Walker Health.
Like, it's just, I have so many questions about that, you know? But yeah, so like, let's get into it. You know, as Joel mentioned, you know, we're going to talk, this is our new little series, COVID Convos, you know? And if you have some interesting things you want to talk about, you can just let us know as well, and we'll include it in our COVID Convos.
Yes.
Yeah, so as you guys know, Whitman-Walker, the past few months, we've been in the space kind of educating folks, you know, building our social media outreach platforms, and then we cover all topics from HIV to STI and sexual health practices, access to care, social determinants of health. But as you know, as of recently, we focus heavily on the COVID-19 pandemic because you know what? It's still here.
Still thriving, if you will.
It's actually still thriving. Okay. So get more about misinformation and like more on our vaccine experiences and the data behind, you know, the rise in the COVID and, you know, who is getting COVID.
Yeah.
And how can you prevent that, you know, and the main thing today, like, is outside closing. With that in mind, you know, what's up, Joel?
I mean, my fingers are crossed that outside isn't closing, but I know that it takes much more than my fingers being crossed. It'll take lots of people signing up to get their vaccines. So we can cross our fingers and get vaccinated. Um, but yeah, it's times like this where I'm kind of like, oh, I remember life pre-COVID, I remember life during COVID, and I know what my life is like now that I'm a vaccinated person during the COVID-19 pandemic. So I guess to get us started, Raman, can you tell us what your life was like pre-COVID vaccine and kind of how the vaccine has empowered you to live your life now?
Talk about living life, y'all. Don't take this away from me. Get your vaccines. Talk to somebody. But yeah, life, obviously, during the pandemic lockdown, right? Like, living with the pre-existing condition like COVID. So, and COVID coming into play, it was a lot of at home, from my desk to my couch to my kitchen to a lot, not going outside, a lot of FaceTime dates, which is, still happening with my friends, love FaceTime. COVID made me love it even more. It's the only way to connect to folks, but, love, I'm not, we need outside. Outside is important. Outside, the sun is important. The community space is important. The exploration of my own backyard is important. Just not being afraid to step out there and like be in community and like be in congregation with people. And that is like, it feels like sunlight. It was vital for me to get back outside because I was going stir crazy being space. So I think that it was hard. It was hard. Pre-vaccine was hard. But again, shouts out to FaceTime. And of course now post-vaccine, uh, being fully vaccinated, of course, which means, after my second shot, um, outside. And honestly, just don't take that away from me. Don't take outside away from me. Okay, the fall is coming. As the data shows, more people are getting COVID than they should, due to the lack of vaccine and the fears around it. We're really here to just normalize that conversation and keep talking about it and really, removing the stigma around it. And what information do you need? What questions do you need answers? We're here. So yeah, if I've been able to, congregate with my friends, like see friends I haven't seen in about 17 months, of course, in a safe space, because we're all vaccinated. We have conversations, even while being vaccinated, we still share our whereabouts and like what risk looks like in that space, but we're less afraid to be together and hug each other. And that's something, like I said, you just needed that, it's a method of like survival for a lot of us, being in community and sharing space. So I've been able to take some trips out of town and, just hang out with my nieces and my nephews and, a lot of girlfriend time with my friends and
Hot girls.
just, as they say, hot girl summer is activated. And it's a hot girl lifestyle. Like, do you want to go back and do that inside?
No,
No.
no, we want it to be girl, summer, winter, fall, spring. But it's
Oh,
not possible if we don't get vaccinated, right? Or the majority of
or
it.
30. I think we're at 48% right now.
We're
Um,
about halfway there.
we're halfway there, but a lot of us, it's just we're not curling over there. So we want to bridge that gap for you. So tell us, Jewel, what was your life like pre and post the vaccine?
Pre-vaccine, um, well, pre-COVID, pre-vaccine, I was living a regular life here in DC. I was going to lots of live events, going to some open mics, some poetry events, comedy shows, salsa, like you name it, live space, I was in it. COVID came, and it really just was kind of the four walls of my bedroom and the shared kitchen slash living room slash common space of my group house at the time. I lived with 5 people who, thank goodness, we were all on the same page about COVID prevention. We were meeting up with each other every couple of months to, like, whenever the CDC had a new announcement, we were like, okay, what does this mean for us and how we move as a unit, as a household with 6 different people from 6 different families. So grateful to have that, because I know a lot of folks were getting COVID early on if they had um, group housemates who weren't as risk averse or who weren't taking COVID precautions and were bringing it home to their fellow housemates.
Yes.
So, yeah, that's what COVID was like then, or like during COVID then. And then with the vaccine, I've been able to go outside more. I can go outside, you know, without so much fear in my heart and in my lungs. I'm able to do a little bit more indoor activity. I definitely try to stay with more of the outdoor activities, but I'll go inside to like a live music event
Mm-hmm.
with my mask on, of course, because you know, you can't trust everyone who says they've been vaccinated. There's no standard way to know who all has been vaccinated. I've heard rumblings of people who want to get like fake vaccination cards, which I'm kind of like, why would you do that? Just, you know,
Girl,
don't, I guess.
Etsy is selling it.
But
Etsy,
it's a business now, huh?
you can get a vaccine card on Etsy.
Yeah. So all that said, I trust my gut myself. I know how I move in terms of my COVID prevention tactics, which include getting vaccinated, wearing my mask indoors. But all in all, my life is slowly starting to look a bit like it did before COVID, where I get to go out to live events, I get to go out to salsa class, I get to travel just a little bit, um, and just kind of resume business as usual, quote unquote, but with safety precautions in place.
And that's all because of the what?
The misinformation, sorry, the vaccine. Yes,
Yes,
the vaccine made it possible for us to leave our houses more safely.
I know. More, that's just, yeah. So you know, what made you like kind of get the vaccine?
I think it was a combination of trusting science and trusting my community around me, like folks like you and other colleagues who had gotten their vaccine. Shout out to Dwayne, just folks who I talked to who I don't know. I guess it just made me feel a bit better that folks who I trusted were also going to get vaccinated. Because I was a bit hesitant at first, but all in all, I knew it was the best thing for me to do for myself to protect myself against COVID-19. But there was so much misinformation out there and so much just false narratives and scare tactics and WhatsApp group threads and all the things that would really just kind of be drilling fear into your heart and mind about how legit is this vaccine that the scientists say we should take.
Exactly.
But very legit. The data says it's legit. The data that shows who's still contracting COVID right now and who's getting really severe symptoms from it and who's at more risk for death. It's mostly unvaccinated people. And I see we have a question in the chat about whether we know that the FDA is approving Pfizer, I guess, for full use versus emergency use. Um, and is it 2 shots or 1 shot with the Pfizer vaccine? The Pfizer vaccine is 2 shots. Thank you, No Filter DC. For the FDA approval, Rama, do you have any updates on that?
Yes, I can tell you a little bit about that. As far as let's think about what being approved means. FDA approval versus, it's not that it's not approved. There's an emergency um, authorized emergency use at the moment, right? So that just means that if, because we are in a pandemic, so the FDA, there are parameters set in place to ensure that this vaccine gets to us sooner to prevent the death and the crises. So it's an acute method. It's not, it doesn't take away, it's not necessarily too different. It's just like the process is short. It's still the same ethical process. It's still there are more resources behind to ensure that it comes out to us in a way that doesn't compromise the ethics and the effectiveness of the vaccine. So it's
Yeah.
really important that we know the difference. Like having it the emergency authorized use is not, it's not less than the full approval. Essentially, if anything, there's more put into it for it to come out sooner for us, like the data behind it. And yes, clinical trials will continue before, that final stage, but it's like, it's not something it doesn't negate the effectiveness of the vaccine. So it's really important to remember that they are there. It does not compromise the ethics of it. So it's really important to make sure that you remember that's set in place for us to be safer, to be able to live, because it's like this is a crisis essentially. So I want folks to think about, let's say if you have $100 to start your business versus $1 million, you're gonna kick the ground sooner. Your business is going to boom sooner because you have all the resources behind you. So really, it was like essentially a table of everyone. This was an all hands on deck situation, which is how emergency authorized users work. So just keep it.
And if hopefully this analogy works or this metaphor works, think of it also like, getting your learner's permit versus your driver's license. Like, they put so much time and hours and effort into teaching you all of the rules of the road before they give you your permit. But once they give you your permit, which is like the emergency authorization use, you're good to drive, to take that shot. You're good to start to learn or adapt more to this life of learning to drive physically. But they've put all of the hard, like preparation, if you will, into the first round of your learner's permit or your emergency use. But it's still safe for you to be on the road. It's still safe for you to get the vaccine before you get your license or the full approval from the FDA. So we promise no one's trying to hurt you. It's just the safest and fastest way to get everyone, as many people as possible, protected from COVID was to do the emergency use authorization.
Exactly.
Or to get their learner's permit.
Yeah. Yes, the learner's permit. Good one, Joel. Is there a database to keep a record of of course, who's vaccinated? And I think, again, it's really important to make sure that we remember that HIPAA, protected health information is still in play. So you're not going to know exactly who, but there's data of percentages of like who's been vaccinated in your city. Because once you do get vaccinated, there are some criteria, some demographic information that you would share, so we can know your location and when you're getting vaccinated. But as far as like the names or specifics like that, you won't have that. But yeah, if you like, it's everywhere. Like, that's how we got the 48%. So there's like data coming out consistently in reference to your city, your state, your county, just depending on what you're looking for. Countries, especially when you're traveling, it's nice to do that extra research to see what their vaccine rates are. And that's something that you can find in the CDC's website, simple Google search, and you will get that. I'd make sure it's from a credible source.
That part.
Go to the CDC website and get all those numbers. Follow the CDC also on Instagram, and they tell you so much.
Yeah, they're everywhere. Facebook, Twitter, Instagram. Yeah.
We're everywhere.
Yes, exactly. Like us. Wow. I think when it comes to like, just people's rejection or hesitation around getting vaccinated, it really does come down to a lot of conspiracy theories and misinformation. So I know for me, I've heard things like, oh, like, I don't need the vaccine, I'm using my herbs. Like, I'm taking the oregano for the respiratory stuff, but I'm taking this for this other thing, and the ginger keeps me in good health. COVID doesn't really recognize herbs like that. I hear things like, oh, my immune system's going to kick in. Like, I've never gotten really sick in my life, but this is a new virus. Like, it doesn't care how strong your immune system has been in the past. So, again, get vaccinated, everybody. There's also the WhatsApp threads. I know this is like more severe. I think it's more severe in immigrant families. So my family is from Liberia, but that WhatsApp thread was popping when COVID first started, and still has a lot of new threads and new messages today that are like, make sure you squeeze this lemon into this water and boil it and put this ginger inside and then take it in this tonic. Like, there's just a lot of remedies out there for battling COVID, but the main remedy that you should really concern yourself with is the vaccine. And you can schedule a vaccine appointment with Whitman-Walker Health. You just call us at 202-207-2480. But, Rama, I'm curious to know, well, sorry, the last thing I've heard from people is that they're waiting to see what happens.
Mm-hmm.
And it really just becomes a game of waiting to contract COVID to an extent, depending on how you're moving. Are you a person who's staying at home all the time? Or are you trying to enjoy your hot girl, hot guy, hot person summer? Or
hot human summer.
Hot human summer. We're all going to be hot and human this summer. So it depends on how you're moving, how you're protecting yourself, and how you're and what you are doing to protect yourself. So one of those ways to protect yourself again is to get vaccinated versus to wait and see what happens and then possibly contract COVID during that time, because it affects so many of us differently. that we don't know how it's going to react with our bodies. And I said we got a question of whether or not Whitman-Walker offers the Pfizer vaccine. I believe the answer is no. We have only had the Moderna and the Johnson & Johnson vaccine.
Yeah, and we're both Moderna girls. We both,
Not
yes, we both have Moderna. So, yeah, a lot of folks are like, oh, Pfizer came, this and that, but the efficacy, the percentage around it it's very small. It's about the same when it comes to Moderna, and they're all in the 90 percentile. So that's generally how to look at it. Yeah.
What misinformation have you heard on your end, Drama?
I concur with everything you said, especially the WhatsApp. It's just I've had to like turn it off and say, I'm here for herbs. I'm here. Immune boosters will never hurt. Okay. But I definitely, your number one, as Joel said, is this vaccine. Honestly, if you're really looking for that protection. And again, it's also not 100. That's why it's important to make sure you keep that in mind. But it is the closest you can get to prevent hospitalization and fatalities when it comes to COVID-19. Something that I've really heard a lot is fertility, right? There's the misinformation around how COVID affects fertility and, it not being approved as we came out. It came out too fast, and we were able to answer that on the front end here. But it's important to remember that if you're thinking about getting pregnant, if you want to get pregnant, one of the biggest things is to ensure that you're taking care of yourself and that you're in a healthy space to do that. And that is what this is essentially, because you don't want to further compromise your immune system as you're thinking through carrying a life, which is already, it's really important for your body to be in a specific state. And studies done by Pfizer, the FDA, Moderna, CDC, other researchers show that there's no scientific proof, that the COVID-19 vaccine impacts your ability to get pregnant. The two, it doesn't correlate. And I think another big thing is for folks to remember, we are all different. So this is more, yes. And when it comes to the sample size of the vaccine, when the clinical trials happen, this is probably our largest and most diverse that we've seen in our time when it comes to a clinical trial for vaccines, as far as like representation from race, identity, from race, gender, ethnicity, sexual orientation, and comorbidities. We've never seen this before. So it's really important to be mindful of that, but it's still not encompassing of the 7 billion people around the world. Nothing will ever be. So the one-off things that we see, keep in mind, again, we don't know that person's health history. We don't know their records. So think about who you trust as a provider or as a community member. Trust them to not steer you wrong. Trust them to answer your questions properly. At least give the chance, and don't give in to the misinformation and the stigma and the rumors and I heard this today, without actually fact checking. It's really important to fact check. And we are the age of like the internet. So people have the platform to do whatever they want on the internet, so it's extremely important to make sure that you do that. To make sure that you fact check for yourself and, increase your own knowledge. Like if you have a provider or you don't, Whitman-Walker, we could be here to talk to you, and answer those questions that you have. But it's extremely important to do your own research and be your own informant, especially with something so new. If you're on the fence about it, I know that's how I trusted it. It was really important to make sure that the data behind, like I said, Pfizer, the FDA, the CDC, as a foreign-born person getting vaccines, I've never had the opportunity to really conduct this much research on it. So just seeing the sample size of the clinical trials was like huge for me, because that hasn't been the case. So again, we're all unique. We have unique DNA, unique identifiers. So when you see stories about the effects of the vaccine, just like some people are hesitant about the vaccine working for everyone, the side effects are also not the same for everyone. We are unique, unique identifiers. So just remember that.
Yeah.
And question. You deserve for your questions to be answered. You are autonomous over your health, you know?
There are no dumb questions around the COVID-19 vaccine. So please, if you're in a space, if you're in the chat right now, if you are in your doctor's office or with like a person who can answer your questions, just do it. Ask them whatever is concerning you or weighing on your heart or your mind about why you don't think you should get vaccinated just yet. And yeah, sorry, I have to toot that horn about everyone being so different because, like, if we were all the same, if we all reacted to things the same, we would all have the same allergies and the same ailments and have them all at the exact same time with the same intensity. So we're all different, and don't let one person's experience, even though it might be really terrifying with the vaccine, uh, you know, rule out how you want to move forward with not getting a vaccine.
Really important. Even we heard about the increased sizes in the heart when it comes to Moderna, some of the side effects, or when it comes to J&J with the leg. But did you all look at the numbers versus 2 million people getting vaccinated and then 6 people having those side effects? So it's important for you to really look at the actual data and the facts, and don't base it on assumptions. Don't base it on general pop. Like, just really important for you to do that research for yourself.
Yeah.
And so it's there.
Yeah, exactly. 1 in a million chance.
1 in a million.
On that point for like everything, but think of all the times you've walked outside and you've been like, oh, there's 1 in a million chance that I'm gonna do XYZ today. Like, this is that 1 in a million, y'all.
Yeah.
Rama, you were one of the first folks to get vaccinated way back in December. What led you to want to get your vaccine?
I mean, as I mentioned before, again, just obviously being in healthcare, and then I know that coming back to the office, who I see the risk really, the benefits really outweigh the risk, and it still does for me. And that includes the J&J vaccine, my friends. So we have to think through that. Like, again, the facts behind it. Things happen, but the facts behind it. But I got Moderna. So I was honestly waiting around for the vaccine since when it first hit the news. I was like, we have to get the EUA ASAP. I am ready to get vaccinated. So, and trusting the science, doing my own research, again, protecting my community members, protecting myself as someone who lives with the who has comorbidities, like I live with a chronic condition. So having the not having the vaccine was never an option for me. But I'm also very empathetic to the lens of the of our, especially Black and Brown experiences when it comes to healthcare. So that's why I open and honest conversations with folks, so that we focus on the facts and understand the growth of the medical ethics boards nowadays in comparison to history, although things still happen today to us, but we have more power. The little bit of power that we have is just more so for me, maximizing on that. So, and
Yeah.
Why did you get vaccinated, Joel?
Thank you for sharing that. It really is, our job, our opportunity to educate ourselves on what we are and aren't willing to put into our bodies, right? For me, it was really about protecting myself and my community, and I think it really came down to, again, conversations with you and another colleague, Dwayne, and I just, I knew I'd be in this position asking people, like right now, to get vaccinated. I wouldn't be able to do it in good faith if I hadn't personally gotten vaccinated. You mentioned, being an immigrant and getting vaccines. Like, I've gotten vaccines all my life. My mom is an immigrant. We travel home to visit our home country of Liberia. Like, I've never, I've never not accepted a vaccine or some kind of injection. So I would start now. And then I think I also was cognizant of how in demand the vaccine was. Like, you got yours in December, I got mine in January. I think it was that same week or the week prior and the week right after that the website here in DC kept crashing on people. And so scheduling was an issue. And so if I had this opportunity, this chance ahead of so many people, this privilege ahead of so many people to get this vaccine, I wasn't going to miss my shot.
Right.
And to that degree as well, we had one of our providers on last week talking about fertility and COVID-19. and her name is Oli, and she kept saying, there are millions of people, billions of people worldwide who are waiting for their chance in line to get the vaccine. And here in the US, we're all privileged enough and fortunate enough to all have a chance to just schedule that appointment or walk into that vaccine site or what have you to get our vaccination. So how could I let that opportunity pass me by? I couldn't. So, Moderna Mafia, gang, gang.
Yeah, gang.
um,
Yeah.
But yeah, that said, life's definitely gotten a lot easier to navigate after getting my vaccine during this pandemic that is still ongoing. So we just wanted to share a few data points about what's happening. Last Friday, at a COVID-19 briefing, Dr. Rochelle Walensky, who's the director of the CDC, said that this is becoming a pandemic of the unvaccinated. So the folks we're really seeing get these new cases of COVID-19 and who are being hospitalized and who are really sick or dying are people who are unvaccinated. And it is overwhelmingly, like almost 100% of the folks who are in the hospitals and sick with COVID right now are unvaccinated people. She also went on to say that more than 97% of the people who are getting hospitalized with COVID-19 are unvaccinated. So there's your data point. If there was 100 people standing in a room and 97 of them were unvaccinated, that 97% or that 97 people are definitely about to get COVID and be hospitalized, depending on how severely they react to COVID. This past Sunday, the U.S. Surgeon General, Dr. Vivek Murthy, shared that 99.5% of the deaths are among the unvaccinated. And in turn, it is really our job to get as many people vaccinated as quickly as possible so that we can avoid any more unnecessary deaths. We've already had so many during this pandemic. It's so many that could have been preventable if we had taken different actions earlier. And so the main action that we were waiting for so long was a vaccine. It is here, so let's take it, everybody. And then it's on that same note, it's just really important that young people get vaccinated. That is one of the most at-risk groups that we're seeing right now. People who are under 50 and just younger than that are really driving some of these new cases. And then we're also, as we kind of wait for more folks to get to the end of their wait and see point, we're excited that there will be some people who might have to get vaccinated through work, whether their employer requires it and they're willing to take that step, or if they might be in a nursing home, hopefully they'll get their vaccine. That's been a kind of a hotbed of new cases arena as of late. But all in all, we just hope that folks don't pass up their chance to get this shot that so many people around the world are in line to get.
Absolutely. Thank you for sharing that. And like that 97% like of people, it's just to me. And I think it's so important for us to remember that and remember the data points. And as the main thing that scares me about, I'm just in fear to going back to the space of 20, the pre-vaccine space when the pandemic first hit for that year. It was very, very challenging to live through that. As you all know, the mask mandate in LA County is back, and which is something that we all need to make sure that we know that that's probably where we're going to next. So actively wearing your mask now, especially in spaces where you don't know folks' vaccine status, or you're not having the preventative conversations or their safety measures, their practices. It's so important, especially when you're indoors, when you're around folks. Please make sure that you're doing that. The Bay Area is next in the conversation to max mandate. And as you know, 2 months ago, the CDC went on an honor system. And about folks not wearing their masks in spaces and just kind of removing that mask mandate for everyone. For those who are vaccinated, they said, but people are interpreting that it's for everyone. So it's extremely important to make sure that we are mindful of that and protecting ourselves. And as you know, the Delta variant is now the dominant strain in the US. Globally. So it's easier to catch and it's more dangerous, especially if you're not vaccinated. So vaccines have caused a severe and a good and a decline in new cases, of COVID-19. So and that's like in everyone. So just like every other health issue, every disparity, it affects the Black and Brown communities the most. So this is, I think, for the first time in history, I mean, we were prioritized for this vaccine. They came directly to our neighborhoods for this. If
Knocked on doors in our neighborhood.
doors, people are canvassing, and just think about it. Our Caucasian counterparts lined up first, and those are the communities that are living. We are still dying. So it's just important, whatever your why is, whatever you need to be clarified, it's so important for you to go to that public health person that you trust in your family, or go to that provider that you trust, or find one that you trust. Do the research yourself. More, you want to do that with Whitman-Walker, you see our comment down there. It's extremely important. And just one more thing, remember that our cases have tripled in the past month. June alone, we had 12,000 new cases of COVID-19 in the US. As of July 19th, it was up to 35,000 new cases. And this is, this is in the Washington Post. It's everywhere. The data is out there. So it's something that can be preventable, and it can be prevented. So just please make sure that you're keeping that in mind, and taking care of yourself, taking care of your community, getting your questions answered.
And speaking of getting questions answered, Goldstein Bianca's got a question. I can't if it's have any COVID-19 deaths, like was the person vaccinated, or if there's been any deaths related to the COVID-19 vaccine. I believe maybe there's been like one person.
I think one like that. And again, as I mentioned before earlier,
but not from the vaccine, from getting COVID, even though they were vaccinated.
Yes. So make sure remember that. And we still don't know, folks. You don't know what they're made up of, their DNA. We're all different. Things are going to affect us differently.
Yeah, but we invite you to call that number at the bottom if you've got any more questions or concerns or things you just want clarification around the vaccine. Please call us at 202-207-2480, and our teams can help you get your questions answered, and hopefully alleviate your stresses and concerns around the vaccine.
Thank you so much for sharing space with me. And Goldstein Bianca also earlier mentioned that emailed someone the portal. Just send us, call this number, send us a DM directly, and then we'll be able to support you.
Cool. Well, thank you everyone for joining us today.
And there are walk-up vaccine sites everywhere. Google. Okay? Thank you. Bye, Jewel.
Bye-bye, everybody. Have a good rest of your day. We'll see you next time for COVID Convos.
COVID Convos.
Oh, and next week, I think we're talking about dating and sex and COVID, so that should be a pretty interesting one. How are you filtering, or are you dating yet? And if you are, how are you filtering out or learning about people's vaccine statuses? How are you bringing up that conversation in addition to your STI conversations and sexual health conversations? So join us next week.
Join us next week. Bye.